Scientists say the first human trial of an experimental vaccine against Ebola suggests that it's safe and may help the immune system to combat the virus. 20 healthy volunteers in the United States were immunized in the trial. None suffered noticeable side effects.
Finally, after months of dark news about the rampant spread of Ebola in West Africa, a chink of light. Initial results from the US of the first early-stage clinical trials of a vaccine showing promising results. The 20 healthy volunteers who received it, all reporting no serious side effects and developing an immune response within 4 weeks.
I think this is now at the point where it needs to go for larger trials to ask what is the best dose. Does it need a second dose? How long do the antibodies last? Will it protect you for 6 months or a year or 2 years? So there's a little bit more detailed research to do before moving into what we call an efficacy trial.
That means it could be a year or probably more before a vaccine might be available to tackle a virus which has already claimed 5,600 lives.
Here in Ireland, efforts are also being made to try and find a solution to the Ebola crisis. Here at the Irish Blood Transfusion Service, they're working with an Irish startup company called Hemanua to develop a device which could be used to treat Ebola patients.
So we're going to open the valve.
It takes a blood donation from a recovered Ebola patient and, using only gravity, quickly extracts the antibody-containing plasma.
We take their plasma and transfuse it into a presently suffering Ebola patient. Then it gives them, in simple terms, a fighting chance to respond in terms of their immune system. The World Health Organization have put forward that as an appropriate approach for Ebola actually in September, because really none of the vaccines yet have come through to the final stages of testing.
Remember, these are patients who've just recovered from Ebola virus, so they're not in great shape overall, but this device allows us to give them back the red cells so they can give repeated donations without becoming anemic.
The device is now ready for field trials by Médecins Sans Frontières, and it's hoped that in the next few weeks it will actually be used in the fight against Ebola. Will Goodbody, RTE News.